In its probe into 300 deaths across the world since last year, the World Health Organization has flagged 20 toxic medicines from India and Indonesia as substandard. Among these are 7 India-made drugs for which the WHO had issued medical alerts earlier in what has been a year of controversies for Indian pharma. India has been quick to react. In each of these cases involving toxic drugs, the Central Drug Regulator launched swift investigations and halted production at the manufacturing units. After deaths in nearly 3 countries were linked to India-made medicines, the drug watchdog has also gotten proactive with a nationwide crackdown on pharmaceuticals. Following questions on India's drug standards, the Indian government now has a blanket quality test on Indian drugs meant for exports.
It is the drug manufacturing company who has got 100% export-oriented unit to ensure to follow all the drug standards of the importing country. And importing country has to have the set system or mechanism to ensure the drugs being imported are of that particular quality. The government has taken the right decision in the right direction, going to bring up a new drug export policy to rebuild the faith of the Indian manufacturers in all of the world.
In an interview, Union Health Minister Mansukh Mandavia said that the centre now has a zero-tolerance policy towards spurious medicines. Mr. Mandavia said that India will never bargain on quality of medicines. He said, "We are always alert to ensure no one dies of spurious drugs." The past year has been one of big learning for the Indian pharma sector. With loopholes in our drug regulation system now exposed, the centre's focus is both on punitive and corrective measures. But even with the renewed focus, we have a long way to go to rebuild our trust as the world's largest supplier of generic medicine. In New Delhi with camera person Sushil Rathi, Vedant for NDTV.